You're listening to the Inspired Mom MDs Podcast. I'm your host, Dr. Cindy Van Prague. I help physician moms take back control of their time and energy so they can prioritize what matters most and thrive at work and home. In each episode, I bring honest conversations, inspiring stories, and practical strategies, including interviews with incredible women who are redefining success on their own terms. Let's dive in. Hello, everyone, and welcome back to the Inspired Mom MDs Podcast. Today's guest is Dr. Elissa Gartenberg, a board-certified family physician, Mayo Clinic-trained physician, educator, speaker, and founder of a concierge and integrative medicine practice in Scottsdale, Arizona. What drew me to her story wasn't just the practice that she built, but the life that she built. After stepping away from traditional corporate medicine and creating a practice that aligned with her values, she made another unconventional decision, pursuing foster parenthood as a single physician. What followed was a journey that ultimately led to adopting her son. More on that later. Today, we're talking about career design, fostering, and adoption, and the realities of navigating parenthood as a physician, and what happens when you trust a path that doesn't look like everybody else's. Welcome to the show.
Thank you.
I'm so glad you're here to tell your story. Before we talk about motherhood, I think it's important for everyone to just understand your career path that you're creating at the same time as your motherhood path. So, can you briefly tell us about that?
So I started a private practice about 11 years ago. I did traditional insurance and saw traditional patients from Medicare to newborns and all between. And it was great for a while, except since the pandemic times, the payments were getting reduced and I was spending more time with patients, and the way the payment structure was working, I couldn't keep up with the demands of both taking care of my patients and having enough financial backing. So I decided I wanted to continue doing my own style of medicine, which I started this practice doing, giving my all to patients and giving the better care that I saw fit. So I converted to a concierge type model, like a membership model. And concierge has a weird connotation, but I am a traditional concierge physician. All my patients have my cell phone number. They call me anytime they need something. They usually don't bother me so much during the nighttime. They understand I'm a single mom with a child that I, have other demands going on. So they're pretty patient and understanding with me, but they do have access to me 24/7. It helps to identify problems early so that I can help people. I had one lady, for instance, she was in the grocery store and she was having some neurological symptoms and like dizziness and headache. And she calls me on speed dial, and I was walking through, what was going on with her, ended up sending her to the ER, and she was having a stroke. And so it was like so convenient at the time for her to get that care, because she might have just blown it off otherwise or passed out in her car or something, God forbid. So luckily we were able to take care of her. And so this type of medicine is the type of medicine I like to practice, where I'm more hands-on, more involved with the patients, and when they need something, they can reach out to me. And I also do a lot of preventative care. So I designed my own preventative integrative medical assessment, I call it. I've always done evidence-based medicine as a Mayo Clinic-trained physician, but then I do more holistic type medicine too. So I trained in medical acupuncture and Chinese medicine. I dabble with Ayurvedic medicine and functional medicine. And so I created this preventative integrative medical assessment where it personalizes a patient's history, their evidence-based history, and combines the different holistic types of medical care into like an assessment where you could see all like how they overlap a lot with like the treatments and they're identifying issues in the body. And it's fascinating to me because you see themes going on, and I can analyze using AI analysis too, a more comprehensive clinical diagnosis. So I do this like facial analysis and apply that to this assessment where it identifies early stages of blood sugar issues or little abnormalities that could often get missed when you're looking at trends in the labs. So it's like a microscopic look at those trends. So it's been really interesting to identify those types of issues, and then we can apply lifestyle changes to the patient's care so that they can better themselves without medication if possible. But sometimes we start early on medications too. So we have that,
Yeah.
the whole repertoire available.
Yeah. I love this, that you're very focused on the preventive side and spending time with your patient and looking at the whole body, the whole picture to pick up these things before they become an issue. And your patient in the grocery store shopping was, wow. My mind just kept going where that could have gone if she didn't get care from me right
Yeah.
then. I'm so thankful for that everything turned
Everyone
out
should have a
okay.
doctor in
Yeah.
their pocket, right? It's like,
Yes, a doctor in their pocket. So, what were some of the biggest lessons you learned from starting your own practice like this and starting your
oh,
own structure?
so in the beginning, when I first started 11 years ago, I talked about it for years prior, and I never pulled the trigger to just do it. And I had a friend ask me, well, why aren't you doing it? You keep talking about it. I had that aha moment, was like, yeah, I'm going to do it. It was the scariest thing I think
Yeah.
I've done, like almost like jumping off a bridge or, but
Hmm.
I managed to figure out how I got loans, and I did everything from scratch. So I didn't want to hire a consultant, which
Hmm.
was part of my stubbornness. Financially, I didn't want to spend the extra money on
Hmm.
doing that. So I learned it all myself, how to do the credentialing with the insurance companies and get my Medicare IDs figured out. And I did the build out for the building. I purchased a building at the SBA loans and the practice loans, and did all of the ordering for the supplies. And so I learned every aspect of the IT stuff and how to organize the whole practice. So if anything went wrong, I wasn't reliant on an individual to just help me. I created my own website. I did everything. So it was challenging, but I learned a lot, and
Hmm.
it was very hands-on learning. So it was rewarding when things were busy and I had the following, but I didn't have to call up an IT guy to come in and help and figure things out very often.
Yeah.
So that was rewarding in that sense, that try to I could try to figure out what was going on, like if there were any hiccups along the way.
Yeah. So you're very self-driven and like to get in there and do things yourself. But you mentioned several other people that could have helped. So if someone wanted to start up a practice and they really hated one portion of a startup, they could outsource
Yes, of
pieces of
course.
it, but you didn't need to outsource. So yeah,
I did
go ahead.
try in the beginning to
Hmm.
outsource a couple things like the billing, but I kept running into little snafus with the different billing companies, and things weren't getting done the way at the speed I wanted them done. So
Hmm.
I just took the reins and did it
Hmm.
myself.
Now, I'd love to transition into your story about choosing to become a foster mom and then adoption.
Sure.
Yeah.
So in my career goals, so I started medical school. I was a little late in the game. I didn't go right from college. I actually decided after I graduated to go back to school for medical school. And so I did all my pre-med requirements. And during that time, I was very driven, very focused on going to medical school. And I had relationships here and there, but nothing panned out where I was, in that married lane to focus on a family. And so I went to medical school, did my residency, and I was so focused on my career during those essential years, I guess. So like when you're meeting a spouse and supposed to start a family and everything. Well, when all my friends were doing that, I was more focused on my career goals. And so I let that aspect of my life slide. And then I woke up one day, I'm like, wait, I'm not married. I don't have kids. I really wanted kids. Like, am I too old? I don't know. So I applied at first for my adoption license. And so I had this adoption license with the state. I explored looking at the Native American side of things also. But if you're not a Native, they want you to foster and not adopt. And so then you're pinpointed as a guardian, and you're never really bonded or officially legally bonded to a child. And so I wanted the whole experience. So I looked into private adoption, I looked into surrogacy, and I decided I wanted to do the fostering. And all right, first I decided I wanted to do the adoption. And so I had my adoption license for 2 years and nothing was really happening. They never called me for an eligible match, which was surprising because there's so many kids that need parents. And
Right.
I felt like it's dependent on the agency too and your caseworker. So there may have been potentially some bias there. I don't know, but I wasn't getting anywhere. And so I was having the routine monthly inspections and the follow-ups and everything, but nothing was going anywhere. So I ended up deciding to do my foster license. And so I applied for my foster license and the caseworker didn't turn in my paperwork on time. So I had to repeat all this foster care college training and all this other stuff again. And so then, which is, extra task because you're doing CMEs and then I'm doing this foster care trauma training and all this other continuing education for that. Finally, I got all the paperwork in, everything was submitted, and they were supposed to come and do another inspection to my house. And there was this big hole in my kitchen. And so it was right after the pandemic, too, where I was like stressing out about that because I really wanted to get this fostering started. But they said they couldn't pass me because of the hole in the ceiling. It was like the rain, the roof leaked. And so the contractors were coming in, but it took them longer during that time period because everything was delayed during the pandemic times. And so they finally fixed the ceiling. It took them 3 months in the roof. So I went to submit for the next inspection, but you have to wait another time period for the inspection. So they gave me a date, which I'll never forget, March 6th. And so they said they're going to come out on March 6th. And then the week prior, the caseworker said, oh, you have to repeat all this other paperwork again. We're not going to submit it because, and I said, well, I have the inspection on Monday. Like, you got to get things going. I think it was a Monday. And she said, no, she talked to her supervisor. They had to delay it again. I felt so much pressure then because I really, really wanted this foster license. And so I ended up switching agencies at the last minute. I hired an attorney too, because I felt like something wasn't right with this other agency. Not that I was going to go pursue any legal action or anything against them, but I needed some support with an attorney to figure out what I should be doing to actually get my license squared away. And so I switched agencies. They sped up the process. The inspector came out. I passed. Everything was good. And they submitted my paperwork. And so then I had to wait 3 months or a little over 3 months for an answer. And so on June 21st of 2022, I got my foster license. It was a Tuesday. And then the very next day, they called me from the state and said, we have 3 babies. Do you want to take one? And I was like, well, I'll take all of them, but like I wasn't prepared mentally. I just got my license. I was so excited. And they said, one of them really wants you. He's asking for you. And so I was like, how did they know that? Like, but it was like the way she said it,
Yeah.
I was already convinced that I was going to do it. So I said, I have to think about it for a second. So I hung up the phone and I thought, I'm going to call my mom and discuss this with her. But then something told me not to call her because she was going to talk me out of it. She was always concerned about adopting a foster child who has any substance exposure or anything. She was very nervous about that and about what could happen and what kind of services or what kind of problems that they could have. I knew she would probably talk me out of it. So I did not call her and I just called them back. I said, yes, yes, I'll take the baby. So I literally had 90 minutes to go to Walmart, get all the baby supplies that I could figure out to get. And I didn't have a list or anything. And I went and picked up the baby. And it was like, he was the most precious thing. He was 8 days old and he was the cutest thing ever. And he was smiling at me. And so when I got home, I called my mother on FaceTime and said, look what I got. And she was pretty shocked. She didn't realize that it would happen that quickly. The other crazy thing was the caseworker from DCS said that he had just gotten out of the ICU and they said he was having some withdrawals. And I was scared about some apneic episodes or anything what was happening. She had no idea. They didn't have the hospital notes or anything to give me to identify what was going on. And I said, well, what do I do? Does he have a apnea monitor or, should he have one? Should I take him to the hospital now to get one? And they said, well, you're a doctor, you can figure it out. So I was up all night watching him. I forgot to get blankets. So I had this little like dog blanket. It was clean, but it had hearts on it. And so it just looked off for him. I was watching him all night. And then the next morning I had to go to work because I am a solo practitioner. So I brought him with me and I did a lot of televisits during that period of time. So there weren't a lot of patients in the office, which was nice. And so for the next couple of days, I had him. And then all of a sudden, they called from DCS and said, oh, we have an aunt that wants him. And I was totally like shocked and I was sleep deprived. They wanted me to drive him to the aunt's house, which I thought was kind of strange too, but it was like a good hour away. And I decided I wasn't going to, in my condition, not sleeping for 2 nights, I wasn't safe to drive that far. And I didn't know the people and I didn't want to accidentally drop him off at the wrong house. That would be on the news. Oh, yeah. They sent out a caseworker who picked him up. I didn't have him for a while. And so I was crushed. I was like in a state of shock and like depression all at once. I didn't know if I wanted to do this again because it was like soul crushing. I knew it was fostering. I knew that was going to be part of the story. When you're fostering children, the goal is reunification. That's it. It's like the goal shouldn't be adoption. It is reunification. And I knew that going in and I thought I could trust that. But at the same time, I felt like this baby was mine. Like I had that connection with him so strongly that I didn't realize that it would happen that quickly too. Just after just a couple of days, I was still out doing things. I wasn't bedridden in depression, but I just didn't know if I wanted to do fostering again. And during that time, they called me for some other children to see if I could take them. And I just wasn't ready, like mentally at that point. I needed some time. And so then a couple weeks later, they called and said there was a disruption with the bio family that could I take him back again? I said, well, I'll take him back again, but you have to guarantee that you're not going to just disrupt it all over again for someone else coming out of the woodwork, because that baby is a newborn that needs to bond with someone. And I knew that at least if they were with somebody that cared and loved them at that vulnerable time, that was good enough. But I would be happy, like thrilled to take him. But I just wanted to make sure, which there's no guarantees in fostering. So I couldn't trust the system. But the caseworker said, yeah, we'll do our best not to actively find someone else at least. So they allowed me to take him back. And I was protective at that point too. We had to go through some hell for a while too. It wasn't as easy of a process as some people have to go through fertility treatments and other struggles getting pregnant and losing pregnancies and that kind of thing. But I feel like my story was comparable in that drama, and like it was traumatic. Now I could laugh about it. And I always knew during that time, I'm like, one day I'm going to laugh about this. But at the time, you're going through a roller coaster of bio parent visits and them not showing up, and then court hearings where the judge is just reactivating the case to wait for the parents to show up at the next hearing, which is 3 months down the road. And meanwhile, this little baby's growing and he has no other caregiver, and I'm bonding stronger with him. And it's like any second they could do all the right things and then get him back. And so I felt, even though that's the goal, like I knew it, that's the goal, and you want the bio parents to be ready. But in his case, it would have been really bad if the bio parents took him back. There was a lot of drugs involved, and the bio mother had lost multiple children in the past, and the bio father wasn't stable, and the grandparents were really bad people. And so I knew it was not in his best interest to be reunified with that family, even though they're bio blood and that they're part of them. But it wasn't a safe situation for anybody, even the parents. But so I wanted to do my best to protect him. So I hired an attorney who was helping me through the ordeal, and she couldn't do anything. She had no legal rights. She couldn't even speak for me, basically, but she could at least listen to the hearings and give me some advice on how to proceed next or what I should do. Because as a foster parent, you have no legal rights either. So like the judge could decide, well, I don't like the school he's at. Why don't we switch his school? Or why don't we get rid of the foster parents, assign him to someone else, perhaps? Or so there, you never know. But I mean, that's probably extreme, but there are a lot of vulnerabilities when you're a foster parent. So it wasn't an easy process to say, but it was part of going through the hurdles to get there. And my patients were so supportive during the time. I had one of my older patients, she was really depressed. And I said, well, if you want, you can come and hold the baby. Because for 3 months, I brought him to the office and he was just sleeping in his little bassinet, and I would change him between patients. And so she came and she would sit with him and sing to him, and like he would just sleep on her shoulder. And so she still comes by over the years. She's brought him little gifts and has a good like grandma type bond with him. So that was really special that he could help people. I think it really helped her out of her depression too. And the other patients have always asked about him, and they always like, he was like my little mascot at the office. So I joke that he's been working since he was 9 days old. So he has a good work ethic.
Oh, that's a beautiful story. It sounds like you have a family at your office. It's your patients,
Yes.
but you have a family. Yeah, you have.
They are family. Yes.
So at this point of your story, you're still his foster mom.
Yes.
And at what point did you switch over to adopting?
It took a while. We had a judge that basically didn't want to make any decisions either way. So he never wanted to sever the rights. There is a law in Arizona that after, I think it's 6 months, that the child needs to have like a permanent home plan in place. And so it lasted much longer than that. It was like 20 months before I adopted him. So yeah, it was a hard time, but there was nothing, we're all dependent on what the judges said. But during that course, the judges rotate. So we had a new judge, and then the new judge looked over the whole case and was like, wait, why is this not following the way it should be? And then during that time, I also had a CASA. A CASA is a court appointed volunteer who helps advocate for children. And so They don't usually assign them to an infant because it's more for older children who have a voice in where they live
Mhm.
and what their goals are. And so I wanted somebody to help me make sure he had a voice in the system too. So the goal was to eventually to adopt. And the other struggles that I experienced during that time were with the schools. He was at a great daycare in the beginning. After 3 months, I sent
Mhm.
him to a daycare, and I have a doctorate degree, and the whole system is confusing to me how they operate with these vouchers or the aid that they give through
Mhm.
the state. I was surprised. If I can't figure it out, I'm sure I'm not the only
Yeah.
one. So
Yeah.
I had sent him to this one daycare, and they're in Scottsdale. There's not many daycares that took the DES payments. He was eligible as a foster child to get a deduction on the daycare rate. And so I had to pay out of pocket the full amount for his schooling, but the first daycare gave me a discount, and they were really good. They were supportive. The director, she was also a foster mom. We had this like kindred spirit where we could bounce ideas off of each other, which was really,
Mhm.
I felt supportive. And the teachers were phenomenal there. And so he was there for a few months, but or for a while, for 15 months, I should say. And then there was an opening. I had been on this waiting list for this other school that was much bigger, and they took the subsidy and they had a really great reputation. And so I switched them over there, and I don't want to disclose the name of the place, but
Right.
you're not technically allowed to sit and watch the kids when you're there. But I had come in a couple weeks later, the door was open, and I went to pick up my son, and he was sitting in a chair with a seatbelt in the middle of the room. And I snapped a picture because I thought nobody's going to believe me that he's like sitting in the seatbelted chair. So I had asked the director and the teachers what's going on, and they said, well, he wanted to play with the toys instead of sitting with the circle time, and he had his own agenda, but
Mhm.
I felt like he was prejudiced against because they knew his history and his story, and that he was foster care, and I had to report it to DCS that this happened, and they were like, I mean, that wasn't that bad to them. They didn't think that was like a problem, but I was so upset. I wanted to pull him out of that school right then, but I was waiting on the adoption and it couldn't disrupt too much at the time. So
Mm.
he stayed there. And then a few months later, he went to another school. There was some biting going on in the room, and I was observing. He was not happy there. The
Mm.
teachers that he had after that were really sweet and really great, but they didn't know really how to handle that age group, I felt, because they were all biting and hitting, and they were in
Mm.
that stage of life that they're all like messing with each other. I felt that he wasn't thriving there. So I pulled him out and sent him to another school, and they were awesome. He was doing wonderful, and he was learning language there too. It was a language immersion school. And so he was there for about a year and a half, and then it came to potty training time. And when he started back at the school, I had worked on the potty training all last summer. We were doing it. And then I brought him the first day, and they said he pooped his pants in the room and put a pull up on him, and then he regressed. And I took him to the pediatrician, and the pediatrician said he should be in underwear, but he was in a room with 3 to 5 year olds. And
Mhm.
so I felt like they were kind of catering towards his development should be more like a 5 year old instead of a fresh 3 year old.
Mm.
And so he got kicked out of the school.
Mm.
They knew his story too. His needs were a little bit more probably than compared to the other children. And so they didn't accommodate him with any special treatment to give him some extra support there. So I was personally hurt by all of that myself. But I really feel like there's some discrimination going on. So I've been careful telling his history to anyone right now with
Of
that.
course, yeah. And so this, from the very start, this sounds like an emotional toll
Yeah.
because there's a lot of what ifs and there's a lot of you don't know what's around the corner. And still, all the way up until the adoption, you still didn't have control over his life. I mean, that wasn't your
Yeah.
legal right. So I'm hearing you did get support from a lawyer, and people you met along the way supported you, like the lady with the kindred spirit. What would you advise someone listening today to seek for support to work through such a roller coaster?
I think if it's your frame of mind, how you look at it, if you know your goals and if you have more of a letting go of the outcome
Okay.
rather than and knowing that as long as a child's safe and cared for, they may not, like, I would foster again in a heartbeat, but right now I'm nursing a broken shoulder. So
Yeah.
I'm not in that frame of mind at the moment. But
Mm-hmm.
I suppose if they called me and said they had someone, I would probably just take them with my broken shoulder. But
Mm-hmm.
they, but I feel like these foster children, I mean, if you imagine, they're yanked from whatever they know about life.
Mm-hmm.
And my son, his story is a little different. He was abandoned at birth. So it's still a trauma. And even though he may not remember it or even have any like understanding of it,
Mm-hmm.
it's still traumatic. Birth, I guess it could be traumatic to anyone going through a
Yeah.
birth canal, but yanked from whatever they know is, even if it's not safe, even if there's abuse and other things, it's like that's their world that they understand
Yeah.
at that time. And so there's a big transition and change that they have to make. So any love and support that someone can give them during all of this process can be so rewarding at the end, because at least they know what that feels like. They can understand in some concept, maybe not verbally communicate it so well, but giving that love and nurturing to a child who is in a vulnerable place like that is rewarding. So I think the mindset of somebody who is a caregiver, doctors are like the perfect people, I feel, because it's like we understand where their developmental things could be a little bit off, or
Mm-hmm.
if there's something to be concerned about looking into their cognition or
Mm-hmm.
their behaviors or what have you. We find the resources. We're very
Yeah.
resourceful in that respect. So I think doctors are the perfect people to do something like that. And also, I think you need a strong sense of self, like understanding who you are, where you're coming from, what
Mm-hmm.
your background is, how you respond to anger, or other issues, and then understanding like how you'd want to raise your children.
Mm-hmm.
But there are legal things you have to follow too. I feel like the way the system is made right now, they want a special type of person, which is extremely rare to have somebody who's nurturing and loving, willing to spend their money and willing to give their all to a child, yet they can be removed at any point
Yeah.
without much notice. And then
Yeah.
where does it leave the caregiver? I've only dealt with it for a couple weeks, but I can't imagine having somebody for years, having a good relationship with that child, having that bond, and having it just yanked away from you all of a sudden. It could be devastating. I've heard stories like that. So resilience is another big motive that you should have when you're fostering, I think, too, to understand like,
Right.
okay, I can get through this. You get through other things, but not that you're asking for something like that to happen, but it's like, or
Right.
understanding like you want a relationship with the family, the bio
Mm-hmm.
family, or whoever they're being reunited with.
Well, thankfully, doctors are very resilient to begin with. And I like your
Yeah.
point that a foster child would be in a unique position if they were placed in a physician's home because they would get those specialty eyes on them, maybe catch things a little sooner. But I'm just curious if people want to talk to you further. You have learned a wealth of information about how to be a single mom, a physician, fostering and adopting. And I know there's a lot more depth to your story. Are you open to speaking with people, or do you have,
Yeah.
how do you connect with people to talk about this?
Well, I have Instagram, I
Okay.
guess the modern way to communicate.
Yeah.
So yeah, so
Okay.
it's Dr. Gartenberg. It is Dr. Gartenberg. I'm also on LinkedIn
Mhm.
and Facebook.
Okay.
So
Wonderful. Because I'm sure there are 100 questions that people are thinking right now. They're like, well,
yeah,
what about this? And what about, unfortunately, I don't have the bandwidth to get to everything, but my goodness, there is so much to learn about this. But the best part of the story today is that your son is with you
yeah,
and you are his mom, and
yes.
that it worked out. And just, I'm so happy for you that this has worked out.
Thanks. I know it's hard to get too mad at him. Like this morning, I was running late. I'm like, I have this podcast to do. And he was hiding under the bed with my phone playing games, and I couldn't
Uh-huh.
reach it. And I was like, okay, I'll just tell the story on the podcast.
Yep. This
What
is a
else can you do
reality.
nowadays?
It's life. Oh, he sounds like a beautiful soul, beautiful
Yes.
spirit.
Smart. He's talented. He's a little musician and he
Oh,
loves music, and he taught himself how to play piano. He's speaking Spanish now, and
hmm
he's so appreciative too. It was his birthday, and he was
oh,
thanking me
happy
all day
birthday.
for all of his gifts, and he got a
Wow.
new bed.
Well, happy birthday to the little guy. Thank you for carving out the time today to talk to us
Oh, of
about this.
course.
I really
Thank
appreciate it.
you. Thanks for having me.
Of course.
Or us, I should say.
Thank you so much for tuning in today to the Inspired Mom MDs podcast. If this episode resonates with you, please share it with a friend who might benefit too. And I'd be so grateful if you left a review so other women can find me too. You can also connect with me on LinkedIn and explore free resources at inspiredmommds.com. And just a quick reminder, this podcast is for informational and educational purposes only and isn't a substitute for medical advice or care. I'm a board-certified physician, but this content isn't connected to my clinical practice, and no doctor-patient relationship is formed here. Please always talk to your own health professional about any mental or physical health concerns. And as always, take what helps and leave the rest. See inspiredmommds.com for full disclaimer.